Welcome back to Priority Traffic Podcast, where we provide actionable advice, tools, and tips to help you become the best version of yourself that you can be. I'm your host, Chris, and in today's episode, I get to sit down with Dr. Trevor Kauer, a researcher and professor of the interpersonal, family, and health communication at the University of Nebraska-Lincoln. He is an expert in mental health among first responders, particularly their experience of stress, trauma, and their difficulties. Dr. Kauer draws on his experiences as an EMT and working in a rural fire department to shape his research and understand the lived experience of first responders. Driven by his passion to create and test practical mental health tools and interventions, Dr. Kauer is dedicated to being part of the change in our field. Please listen in as Dr. Kauer and I discuss the results of his latest study, learn from Dr. Kauer's unique perspectives as both a firefighter and first responder, and explore innovative strategies such as the expressive writing intervention that has shown positive results in improving mental health. And while I have your attention, if you believe first responder health and wellness is the foundation of high performance and crucial to our success in the field, click that like and subscribe button. Turn on your notifications and stay up to date with all the latest when it comes to wellness, performance, and personal growth. If any of this sounds valuable to you, please share it with your friends and communities. Thanks again for your support. Now enjoy the show. How you doing, Trevor?
Good. It's a really great fall day today, so I'm feeling good and I'm excited to talk about mental health with you today.
Yeah, absolutely. And I think you actually have quite the perspective on mental health, and we can touch on your background, but you were a EMT and you became basically a doctor, or literally a doctor, and now you are researching and studying wellness of firefighters and first responders. So welcome to the show. It's a pleasure to have you, and I can't wait to talk about all the cool stuff.
Yeah. I was an EMT during my undergraduate degree, and it was for a volunteer organization, a fairly large one, and I just found a lot of passion for first responders and the work that we do, and then decided to take it in a little bit different direction. Instead of continuing in first responding as a career, I decided to do research for first responders. So I'm excited.
Absolutely. So in today's episode, we're going to go over mental health and the stigma that surrounds it, how it was created, and kind of why it's being maintained. Maybe we can and we'll talk about tools and strategies to help improve first responder mental health, despite the current barriers that are involved in keeping us from it. And I know we'll get to it soon, but we're going to explore some recent research that you've been doing and talk about the results and how that could impact us in the future.
Yeah.
Perfect. So let's jump right in. So where did you grow up?
Yeah, so I grew up in southern Idaho, a really small community. I grew up on a ranch. I was kind of surrounded by people who were volunteer first responders. In my little town of 100 people, that's pretty much how any like 911 service works in a rural area in America. It's
Right.
the community members, it's my teachers, it's my friends' parents. That's who the first responders were, and so I was involved with that organization in my
Mm-hmm.
hometown quite a bit growing up. Helping out where I could, and then once I got to college, I got an opportunity to take an EMT basic training class, and decided, I think I want to do this in a volunteer capacity. I've always been
Sure.
really dedicated to my community. And then once I got my basic license, I started volunteering for Moscow Volunteer Ambulance Company in Moscow, Idaho, which is in northern Idaho.
Absolutely. How long did you do that for?
Yeah, so I did that throughout my undergraduate degree, so from
Okay.
2013 to 2017, and did that for 4 years, and I really enjoyed it. It was something
Mm-hmm.
that um, it was such a unique way to give back to your community, and
Absolutely.
especially in a volunteer capacity, and really kind of showed me that I really enjoyed medicine, and I really enjoyed helping others in their, typically people call 911 when it's, the worst time in their life. No one just calls 911 for fun.
Absolutely. Absolutely.
So, it's nice to be that person that it's kind of a relief or a sigh of relief when you show up so it's nice to feel, but with that comes a lot of heavy stress and
Hmm.
burden, and yeah, and I think that that aspect kept me from continuing being a first responder or trying to do it as a career,
Hmm.
and realizing that I can do a lot to change that or to try to help first responders manage that in other ways, and so that's kind of what I've done and dedicated my career to. So I recently got my PhD. I'm now officially Dr. Kauer. That's a
Doctor.
more recent development, but I've been studying first responders for about 10 years now.
Oh, that's amazing. So when you say you've been studying first responders,
Yeah.
what in a nutshell, what does that look like?
Yeah, that looks a lot of, well, day to day, it's a lot of reading.
Hmm.
It's a lot of reading and writing as an academic. But what day to day that's what that looks like. But in a larger scheme, it means I get to talk to first responders
Okay.
through studying their stress and coping and their work-life balance and their families. I get to talk to them. I get to interview them. I do focus groups,
Oh,
and I
cool.
kind of just learn a little bit more about just individual stories of first responders. And then through doing all that research and then continuing doing that, I have really been able to identify these elements of how mental health is sustained in first responder organization, and how that stigma is maintained, and
Sure.
yeah, and then again, most recently, try to start figuring out, well, if we can't necessarily change culture, because culture changes very slowly. It's not
Yeah.
something we can just wake up today and be like, all right, no more stigma in mental health, right?
Right.
So until we reach the point where that culture shift occurs, I am really focused on how are we going to manage mental health in ways that deal with those stigma barriers.
Heck yeah. So what, with your experience as an EMT, what is
Mhm.
aligning with your research right now that says like, aha, I experienced this and now it's showing up in data and you're seeing it amongst your interviews?
Yeah. Well, so I think one of the biggest connections is in my dissertation, it was focused on having first responders write their untellable tales. So,
Okay.
an untellable tale essentially is the stories or the information that we don't want to share with our loved
Sure.
ones for a variety of reasons, right? We all have a lot of different reasons, which I've found in research and also just personal experience. We don't want to burden anybody else. We don't want that secondary stress to impact our loved ones.
Sure.
And sometimes it's difficult to be vulnerable. It's difficult to admit that something's bothering you.
Right.
And so in my dissertation, one of the first things that I did was I wrote my own untellable tale. I start the whole dissertation off with writing my own story that I have experienced. It's a call that stuck with me for a while, and that
Sure.
I just have not told anyone. And so I start by writing out the untellable tale of experiencing doing CPR on this elderly gentleman under his Christmas tree on Christmas morning. His
Oh no.
family, his entire family's there.
Yeah.
And that experience, it was one of my first codes in like my first year of working in as an EMT, and that
Hmm.
was a difficult experience to experience. And then I've had a lot of other just difficult trauma situations. One of my
Sure.
first calls as a ride along, so before I even had my license, but riding along to see if this is something I even wanted to do, was a gunshot. Uh, and then like less than a year later, I was had my license, and we were running codes and delivering babies, and
Wow.
it was a lot of, it was a very active, for volunteer ambulance
Yeah.
service, we were very, very, very busy. uh, and I kind of threw myself into it, and then realized after the fact, like, oh wait, I probably need to manage some of this stuff,
Sure.
which is kind of what led me to leave the fire service and leave EMS and go towards more of a route of how do I help other people deal with this and also deal with it myself in the process.
Sure. What did, like, what started to manifest after these calls that were pretty heavy for you? How did that start to show up, and what was like a a red flag, if you will, like, hey, pay attention to me type thing?
Yeah, yeah. Uh, you know, it. the funny thing about trauma is that it rarely happens right after the fact. We think
Right.
that we experience something that's difficult or stressful, and then it's going to be like the next day that it bothers us. And you know, as EMTs and firefighters and law enforcement, that's rarely the case because we
Hmm.
have to do this real cool thing called compartmentalization. So we go to the next call, right? We don't have time in between calls. And so what happens is that it's more like months, years down the road that you
Sure.
recognize that, like, oh, that actually was kind of a stressful, traumatic experience. And it's kind of still bothering me a little bit.
Hmm.
For me, it was this question years later of, am I still good at this? Do I really enjoy doing this? Is this
Sure.
something that I could do for, I don't know, 20, 30 years as a career? It
Right.
was this really like heavy point in my life where I was like, I'm gonna have to decide, like, is this something that I can sustain doing for the
Right.
rest of my life? And kind of a little bit of a wake up call that I kind of recognize that, I don't think I'm going to be able to do this. I'm a very sensitive person. I'm
Sure.
real
Sure.
good at connecting with people, but I'm definitely not as competent at hiding those feelings as some
Understood.
people. And so, and in fire service, there's a level of you have to do the job. You can't
Hmm.
necessarily break down on scene. So that was
Right.
kind of the moment where I was like, I think I need to do something else. But this is really important, and somebody needs to be fixing this problem.
Well, we're glad to have you on it, doctor. And I don't think there's enough doctors, working towards understanding us. And when we talked briefly, you mentioned that there's not very many doctors researching first responders, fire, police, EMS, EMT. Could you explain that a little bit?
Yeah, yeah. So, right now, I study communication. I study like the verbal and the nonverbal messages that we use to connect and to cope and socialize and create our identities, that kind of thing.
I got it.
And while, in other disciplines like psychology, that's first responder research it is fairly common in more harder sciences, and more popular social sciences. In my
Sure.
discipline of communication studies, where we specifically are focusing like what can I say and what can I do to manage this stress, which is something
Hmm.
that psychology doesn't necessarily do as well as my discipline. No one really studies this. There's probably about four or five researchers who study first responders. We're
Sure.
all friends, and some of us, and for the most part, some of us don't stay in academia. We go work in the industry. So, like, we work for peer support programs, or we go
Sure.
work in direct programs. That I've got a good friend who teaches and does trainings for first responder organizations, so there's very few of us who have stayed in academia and that
Gotcha.
focus in on this population and are continued on really focused on doing empirical, scientific work that can lead to policy decisions that can help back up therapeutic techniques that can help,
Sure.
help make decisions essentially.
Absolutely. So one thing that I think about all the time is on the podcast, and me personally, I have this theory. It's not really backed by evidence, but anecdotal evidence and experience is that we all have these traumas, and we get below well, like we're suffering, we're anxious, depressed. There's diagnosis is below that or to the left of that. Then there's like zero, we're neutral, and then we're performing, right? And I think you're typically dealing with people who or researching how these things take us off our game and make us maybe unwell, perhaps. And then how
Yeah.
would you say the research correlates to first responders and a high performance level?
Yeah. Well, I think that's the interesting thing is that a lot of times we do immediately think of doing research only on the people who are currently struggling so that we can learn
Right.
more about them. But what is really important is doing the research on the people who are doing it well too, so
Yeah.
that we know what works. So I think that's part of a couple of my research studies have been it's like one specific I did a couple years ago was about just having conversations with first responders who
Hmm.
experience death at a more regular rate than the general population. And because of that, how did they manage then experiencing and witnessing death?
Hmm.
And also, how does that change their family relationships or how they're preparing for their own death? And that's something that first responders do really well, is that we are not afraid of death like the majority of the population. This is
Right.
not a taboo topic for us that, you know, among a general population, they typically don't want to think about, their death. How do I want to die? We're constantly thinking about it. So because of that, that does allow us to perform a little bit higher because we're more comfortable with the decisions that we have to make at the end of life.
Hmm.
So in that way, like we're high performing, and we're thinking about advanced care directives and DNRs, and we're thinking about that for both us and our family members, which typically leads to us feeling closer to our family because we're engaging in what we call final conversations with our family members, and we're not afraid to do that. So I think that's one of the things is that we can learn from first responders for the general
Hmm.
population is to like not be afraid of death, but at the same time we struggle with a lot of stuff too, like being
Absolutely.
vulnerable and disclosing our stress and trauma and difficulty. And the individuals who do it well, that's who we can learn from as well. So my research also tries to focus in on how we are how what are we doing that is correct, what are we doing that is healthy, and
Sure.
what are we doing that's not as healthy. So things like um, there's a level of escaping from the job, taking time off, turning your radio off.
Yeah.
Right now in the 21st century, we have those fun little apps that even if we are not in city limits or in our call area, we are still getting a text notification of a call that's being toned out.
Yeah. Yeah.
So it's like turning those off, taking a break when you're needing to take a break. That's really important. And some people are doing that and they're doing it very well, and that's very helpful.
Awesome.
But then there's some people that are, really struggling. And those are the individuals that I'm hoping that my research helps the most.
Well, again, so cool to have you doing this kind of research. Before we get too deep into your research, I would like to just maybe
Yeah.
you can help us define a few terms just for the audience. And I have a couple, and maybe you can come up with a couple too. But just the idea of trauma, like
Yeah.
that's a very common word. People are saying it a lot. And
Yeah.
just for the context of our conversation today, do you think we could come up with a working definition and what that is?
Yeah. So when I think of trauma and when I use the term, I think of it as there's two different types of trauma. There's the capital T traumas that we
Hmm.
experience, and those are the experiences that first responders immediately think of. So the gunshot wounds, the stabbings, the very bloody, gory, that's typically what a lot of people think of
Sure.
as
Sure.
trauma. So I call that the capital T trauma.
Okay.
And then there's a lowercase t trauma, in which those are the daily hassles. That's
Hmm.
the rude remarks that you get from a captain or from a chief that you're like, listen, I'm trying my best here.
Right. Right.
It's the little things that start piling up and start really starting to affect us. Those are the
Hmm.
lowercase t traumas. So I think both of those are encapsulated in that word. And then the other unique thing about trauma is that it's very personal. So it's
Sure.
all based on our own experience. So something that's going to bother me
Hmm.
is going to be based in my own past experiences, my own positionality, versus it's going to be different for you, what you find traumatic. And so
Right.
that's the cool thing about trauma. It's also what makes it so difficult to try to manage across the board with things like policies because it's so
Sure.
different for everyone. Um, and so I think that that would be a good working definition. It's typically what
Yeah.
I work from is this idea of
Cool.
capital T and lowercase t traumas.
Perfect. So we got that one covered. What
Yeah.
about stress?
Yeah. I
That's a
I
big
also
one.
Yeah, it is a big one. Yeah, stress is a big one because we know that stress can be very helpful sometimes.
Yep.
There's, a certain point where certain amount of stress can just make us very productive individuals.
Yeah.
Uh, but I think in terms of what I think about stress in terms of first responders and how trying to manage stress so it's not affecting mental health, it's when we reach that point of experiencing stress where it's no longer productive for us and it's now becoming more of a destructive thing in which
Okay.
we are unable to process emotion. We're unable to competently engage in skills like
Sure.
doing an IV or just carrying a patient.
Right.
It's about so it's about that point where we are experiencing too much overload of information, too much emotion, which we're no longer being productive, and
Okay.
it's not a motivational experience anymore, but it's really something that it's dragging us down.
Sure. That makes a lot of sense. I think we've all, as first responders, I think we've all been in a scenario where we've experienced some pressure that gets us moving and then pressure that can be, like you said, destructive. So
Yeah.
yeah, I would say that's a good working term. And then the last one would be coping mechanisms. That's a common phrase that's, at least in my purview, being thrown around more.
Yeah.
And
Yeah.
would you be able to elaborate on that for us a little bit?
Yeah. So again, in my view, through my research, I look at coping mechanisms. I often use the term coping strategies more often.
Okay. Okay.
Um, Coping mechanisms, in my view, they can be both positive, they can both be negative. Say with coping strategies, kind of an interchangeable term there. And first responders engage in a lot of negative coping mechanisms or strategies, things like alcohol use, sleep deprivation, caffeine overuse, nicotine use, right? Poor eating habits, poor
Sure.
nutrition, that kind of stuff. Those are all those negative coping strategies. Positive ones that I'm hoping to talk about more today and that we see are things like physical activity, working out, thinking about what is bothering you.
Mhm.
I specifically look at how writing things out
Yeah.
helps us. That's a good coping mechanism. Um, Talking to a partner, talking to a spouse, talking to somebody about it, and not keeping it inside. Like those are those more positive coping mechanisms.
Yeah.
But really, it's what keeps us from having that stress move from a motivation to a destructive process, right? It's about, and your theory, as you kind of talked about it, it's about keeping us in the wellness side
Yeah.
rather than in like the unwell side of our
Sure.
mental health.
Absolutely. Well, we have a lot to talk about. So, the main reason we are connected today is because you had some research and you were looking for people to chat with.
Yeah.
And I reached out and now here we are chatting. So maybe you could explain the study and then we can start digging into the results.
Yeah, yeah. Well, so the current study I've got going on, it's about how people who are in fire service or EMS or law enforcement, how they
Hmm.
use certain terms or use certain communication practices to reinforce this idea of first responders are like a family to us. So we often hear things like they're like my second family, or like my brothers or my sisters, or and they're like family. So what I wanted to understand is how do we use our communication to reinforce that kind of second family identity? And then
Sure.
with those people, how are we coping with stress through supportive communication with those individuals? So how are we engaging in those more positive coping mechanisms with them to help us? Because oftentimes we're engaging in communication with those second family, first responder family members that we're not, the topics of conversation are not the same as with our actual, what we call biolegal family, or those that have
Okay.
blood or legal ties to us. Because oftentimes they're not in fire service or they're not in law enforcement. And so
Sure.
there's a level of understanding that we don't have to explain when we're talking to somebody else who's a first responder. It makes it just
Right.
an easier process for us. So I'm wanting to know, what are those stories that are being told, and how is support being communicated in a first responder family?
The first thing that comes to my mind when you talk about those conversations and the ease or difficulty it is with certain people is the term jargon.
Hmm.
And I've experienced that. Like my father, he's a firefighter or was, he's retired now. and we can have conversations that include all the terms and vocabulary that you would find on the job or in the truck or on a fire scene. And if I was to have that same conversation with my mother or my wife, the jargon gets in the way, and now I'm defining and explaining terminology and concepts that just hinder the discussion. So I can totally understand what you're saying. So that's really cool.
Yeah, yeah. Well, and that's kind of the background of my own personal experience is that it takes a lot more energy and effort to have to explain what I'm trying to tell you versus if I can just tell you what I'm experiencing. For
Hmm.
first responders, because of mental health stigma, which we will dive into later,
Yeah.
because of that, just disclosing and deciding to talk about it is a huge step. If I also have to add on to that huge step, defining terms and explaining things, then
Hmm.
there's just that much more of a chance that I'm not going to do it again in the future, which isn't super helpful. That's why, we hear a lot of things like, I don't want to talk to an outsider. So you don't want to go to professional counseling or to go see
Sure.
a therapist because sometimes you have to explain all of these different jargony terms or experiences.
Hmm.
Um, Whereas with first responder families, within those like what we call voluntary families. So it's people
Okay.
who we choose to be in this first responder family with us. We don't have to explain. It's a cognitively easier process,
Sure.
which is the academic-y way of saying that. Like it our brains don't have to work as hard to talk about our experiences because we have a shared emotion or a shared understanding of the conversation or the topic.
Absolutely. So again, I think when we have those conversations with those people that we would say are in our second family, like you're
Hmm.
discussing, those people come with a level of cultural competency where they
Hmm.
understand, they've been trained, they've had similar experiences. So, from what it sounds like, if you are discussing these things with someone who is a peer within the community, that conversation can be more therapeutic or cathartic rather than trying to have this conversation with perhaps a therapist or a wife or a loved one who just doesn't quite have the understanding and experience or background that a first responder has. Is that
Yeah.
correct?
Yeah, to a certain extent. Our peers are very important to us. Sorry,
It's all right.
give me a
Dogs are
second here.
awesome.
Oftentimes, we've gone on the same calls, we've worked with them
Hmm.
for a while. They can be really helpful sources of support. Um, Rarely does that happen though in new
Right.
recruits, and that's really important. It's the
Okay.
new recruits who don't have that close, trusted person. That source of support isn't there. So in those cases, we do need therapists and mental health professionals who are culturally competent. That
Sure.
it's hard to find that though, and we really don't have a standardized way of saying this therapist is culturally competent. It's kind of something that a therapist can say, I'm culturally competent in first responders because you know, I've counseled them before, which
Sure.
in my
Sure.
opinion doesn't really make you culturally competent mental health professional just because you've had a couple clients who are first responders already,
Sure.
and so there's that system where we need to come up with more standardized ways of saying I'm a culturally competent therapist for first responders because I've experienced it myself or because I've gone through extensive training to understand these things.
Hmm.
Um, I think there's some really cool programs and some departments across the nation who are specifically hiring individuals who were first responders in the past, went and got training to be a mental health professional, and then they're hired by the department to just be an in-house therapist essentially, but they did the job themselves. Like that is a sustainable, effective model, right? That's
Yeah.
also very difficult to find people who do that.
Sure. Sure. And for all the people listening out there, if you are a junior or even a senior firefighter, maybe take the lead and reach out to your rookies and your probationary and your new firefighters and let them know, hey, I know it's a wild game to play coming into a fire department not knowing anybody, and there's a lot of people in most departments that are helping rookies, but just as a leader, and not maybe administrative, but fireside leader, take them out to the side and say, hey, if you need to talk about this stuff, let me know. And, make that available to them as
Yeah.
someone who just cares. And, at least they have another person within the department who can be confidential and can talk to them about concerns that they wouldn't talk to the other rookie or their boss about, just because they're brand new. And that happens.
Yeah. Well, I think it's also what's really important there too is that we have an understanding of how do we actually do that. It's very
Right.
easy to say, have a conversation. Like you've been there for 20 years and you see someone who's there for 2 years, like reach out to them. How
Right.
do you reach out to them? Because of that
Sure.
mental health stigma, it can be really, really difficult to not only take the step to reach out, but then to make sure that the other person is even listening or going to be receptive to this.
Right.
Um, some of the most successful experiences that I've seen and heard and experienced myself is keeping it casual and keeping it
Yeah.
informal. Anything that's really formalized is going to feel disingenuine, and then
Okay.
it's going to be seen as the kind of like a, I don't know, you have to be asking me about this right now. That for a
Sure.
lot of newer recruits into a fire department, or police department, it's they get asked like, how are you doing, is there anything you need to talk about, that kind of stuff, and it just is too formal, and it really
Right.
just seems like, well, it's your job to ask me how I'm doing, especially since the last 5-10 years mental health has become a really important topic. We are talking
Yeah.
about it more and more, uh, but with the dark side to that, the bad side to that is that because it's now this very popular topic of conversation in the industry, we are afraid that any kind of reaching out for support is just it's part of my captain's job. They have to ask me. So
Sure.
do they really care? And I might think like, yeah, they do really care, but it's still kind of disingenuine that I'm not going to actually disclose.
Yeah.
Or I don't want to be seen uh, as not competent in doing the job, or as being kind of like a burden on them, because I know they're also very busy. So
Sure.
it's hard to know how to have those exact conversations. For me, it was after a difficult call on the way back to the fire station. It was about stopping at this local taco truck and grabbing like a churro or grabbing some ice cream
Sure.
at one of like the local it was like a local creamery that like we would stop and just get, everyone got a scoop of ice cream.
Yeah.
Those kinds of interactions while you're still on shift, you're still on duty, you're with your crew that you just experienced this call, and you may not think that you need to, because again, like I said before, our traumas may not show up until years, months
Sure.
later, right?
Hmm.
But it is a lot less likely they're going to show up later in the future if we handle and manage it today and now and
Okay.
presently. So I think like that's also really important, is to think about how do we have those conversations in ways that it's not feeling too formal, it's not feeling disingenuine.
Right.
It's actually, I care about you as a friend, as a
Sure.
coworker.
Yeah, I think that's a really good idea, and there's plenty of opportunity, assuming you don't get called out again, back to back. But that happens,
Yeah.
and hopefully we can find time to process those calls. So that's a really, really good
Mhm.
idea. Is there anything that, as a new person, you would recommend that they start lining up, like resources? Because I think it's just a matter of time over a 25-year career before it starts to build up, especially if, like, let's say you go to a department and they're not talking about this kind of stuff yet. And not every
Mm.
department is. Some people are just now adopting fitness as
Yeah.
something. So, they're working through it. They're getting there. But,
Yeah.
for the new guys out there listening, new gals and guys, what's a couple things they can do when they're coming into a department that can put them out on the right foot?
Yeah, I think it's identifying who is that one person that you're going to be able to go to talk about this information that you are going to
Sure.
feel comfortable with. It's going to take time to figure out who
Sure.
that is. Especially in your first couple of years, you're probably going to be jumping shifts. You're going to be jumping crews. You may not
Hmm.
find like your immediate fit that you're going to be with this crew for the next 20 years, right? Or you're going to be at this station for the next 20 years. You're going to be moving around. So it's about who is that stable person in the organization that I feel comfortable talking to. Or it's about finding finding somebody at home or a friend who just is there to listen, who
Yeah.
doesn't need to know the jargon, who isn't there to ask you questions. Because oftentimes, like, we don't necessarily want to answer questions about it either. We
Right.
just want to
Right.
we just want to
Get
talk
it
about
out.
it. We just want to say like,
Yeah.
hey, this shitty thing happened today, and I don't necessarily want to answer questions about it, but I
Right.
just
You
need to
can
get
hug
it off
me.
my chest. Yeah,
Exactly.
yeah, exactly. Like,
Yeah.
hug me, be there to support me, but I don't need you to like pretend to be interested. Like, I
Sure.
just need you to listen attentively and be like,
Yeah.
wow, that really sucks, without having to answer questions like, oh, what's an IO? What's your
Right.
trachea? Like,
Yeah. Exactly.
there's like, those jargony medical terms, especially in medical services, which is where my personal experience
Yeah.
lays, is it's I don't necessarily need to explain this stuff. I just need to tell somebody about it and then get it off
Hmm.
my chest. Um,
Absolutely.
and so that's one of those ways. I think another way is it's writing it out. So that's what I specifically study, is how we use stories and storytelling to cope and connect and manage these difficult experiences. So I suggest every single day, you take a piece of paper, write for 10 minutes a day just about what you're feeling after shift, or maybe that's on, the day after a shift. You write
Hmm.
about everything that happened in the last shift and just how you're feeling about it. Because what happens is we keep everything in our brain just locked up and swirling around up there. It is very difficult for us to both structure a coherent narrative or story of our experiences,
Hmm.
and without giving some structure to that experience, we are not going to be able to make sense of it, essentially.
Gotcha.
And
Uh,
so through writing, we get it down on paper. And the nice thing with getting it down on paper is we can like reorder it if we want, or we just kind of, it's this cathartic process of like, I've now thought about the logistical details of this, and it's
mhm.
really important to get those details laid out, and then intermix your thoughts and your feelings about the call, or about, it doesn't even have to be a call either. Remember, like the
Sure.
lower T traumas, it can be like, God, Jim this week said some really stupid shit, and I just has really been pissing me off this week,
Right.
and he's not doing his job, or he's not doing his truck checks right, or whatever. Like, write about that,
Yeah.
and like, how do you feel about it? Jim ain't never gonna see what you wrote. It's
Right.
just a personal document for just you.
Yeah.
And I think that's also something that newer recruits and even people who've been doing this job for years should be
Hmm.
doing, is just keeping a running tally of just, what am I experiencing? What am I feeling right now? And getting it out on paper. Because it can be really hard to find that one person, or just people in general to talk to about this.
Sure. So if I'm gathering what you're saying properly, it sounds like we need to start as a new person, or anybody at any time can start doing this, but basically start building our support network and
Hmm.
identifying the tools. For instance, reflective journaling, where we start looking back on our day, or the experiences we've recently had, and start getting them on a journal. Does that sound
Yeah.
about right?
Yeah, yeah. And I think I don't use the word journal, because I think a lot of times when we use the word journal,
I like
we
logbook.
yeah, like logbook. Yeah. When
Yeah.
we use the word journal, it's so synonymous with diary that
Yeah.
it,
Yeah.
and we're not like, I'm not asking you like, July 30th, today this happened, right? Like, that's not what you're needing to write down. But you're just, doing what I
Right.
call it as a teacher. I'm also a professor, right? So I do research
Okay.
and I teach. I have my students do free writes, right? It's something
Okay.
more akin to that, where it's a stream of thoughts and
Sure.
ideas. It's whatever comes to your mind as you're writing. So what can be really helpful is, like, if you have some kind of a prompt that you give yourself, and like on Mondays, I am going to write about the little things that are stressing me out about my
Sure.
work, right? And so you have somewhat of a structured prompt to
Hmm.
help give you some direction, but then you just write about whatever you want. Um, and it might be the next day you write about more of like, is there a difficult call, or was there a specific patient that stands out to me this week? So you're just attending to your mental health, even though if there wasn't like a single patient that was like, oh man, that was like a really tough call, and be like,
Sure.
this week I didn't really have a patient that stood out to me. They were all kind of just part of the job. And
Mhm.
maybe that's an issue. Maybe I need to be a little bit more attentive of who my patients are and what their stories
Sure.
are, and who they are as humans, because like no one really stood out to me, and maybe I need to be a better care provider that way, right? It's that
Yeah.
reflective, expressive writing is what I call
Okay.
it. That's what's super helpful because we're just spending 10 minutes to ourselves. And it really doesn't need to be any longer than 10 minutes. I think that's really
Sure.
important too, is that we found through research that you don't need to write for more than 10 minutes a day. It's a very, very small amount of time given
Hmm.
all the other things in your life that you have to do, right?
Right.
We are, like you said, some departments are requiring us to work out for an hour per
Hmm.
shift, right? Uh, Instead of viewing it as like this taxing thing, comparatively to an hour workout, 10 minutes is nothing to
Sure.
attend to your mental health. So I think it's just engaging in that repetitive practice of just putting it out of your brain and onto paper, which is really helpful.
Absolutely. So this is definitely something we can add to our routine. If we have a morning routine or an evening routine,
Yep.
definitely make that be, one of those objectives within that routine, and
Mhm.
consistently hitting it is going to have long-term health benefits according to you,
Yep,
correct?
yep. Yeah, yes.
Awesome.
So both like physical health benefits. So we've seen that people who engage in what we call expressive writing, which is this
Okay.
idea of kind of giving it loosely structured writing for 10 minutes a day, that they call out of work fewer days. They go to the doctor less. They have lower blood pressure. They typically in like the social emotional symptoms, they have less depression, less affect, negative affect, like negative mood.
Sure.
Have less anxiety. They typically have more positive, like worldviews. They're like positive, just a general positive mood. So if we do these things for a long period, a long term period, we start to see these essentially health benefits, both mental
Sure.
and physical health benefits. The difficult thing, though, about when we write about our stress and trauma or difficulty is that we see this short term distress first, and then we
Sure.
see long term benefits. But in the short term, we actually see that, like, I actually might have more negative mood, or I might feel a little bit more stressed in the very, very short term, like right after, which makes sense, right? We're writing about difficult things. So
Right.
it's going to make us a little sad in the moment. But what's important is that in the long term, we're managing our stress or our trauma and that difficulty, and we get the health benefits long term. We see
Sure.
those like a week out, 2 weeks out, 3 weeks out for as long as you're doing it. Short term, in the moment, after I finish writing about maybe a patient that reminded me of my own child and it was
Hmm.
really difficult, I'm going to feel sad about that. And we can't let that keep us from continuing that practice, right? Like that I
Perfect.
think is the one thing that might get us, is that we write about difficulty and we don't really feel immediately better, and we want that immediate gratification.
Sure.
uh, and unfortunately, we're dealing with loss. We are dealing with difficult things. We're gonna feel bad about them. That's
Hmm.
also human. It's about
Yeah.
sticking to that writing, because that's where we see in research the long-term benefits, is if we just stick to it. In a research project I just completed, I found that you only have to do it for 3 days, 3 days in a row, to be able to start seeing those long term benefits, to get over the
Nice.
short term distress. And you kind of think of it as like a post traumatic growth period, essentially,
Yeah, like a
right?
little latency.
Yeah, exactly. And we only need to do it for 3 days in a row, 10 minutes a day, three
Nice.
days in a row, and we can start seeing those benefits like decreased depression and decreased negative mood.
Cool.
Yeah.
Would you say that 10 minutes is the minimal effective dose, or is that like the
Yeah,
top
I
end?
I would say it would. I don't think writing for any more time is going to be any more helpful. So
Okay.
yes, in technical terms, that would probably be like the maximum dose.
Okay. Just
I,
I was just
I,
curious.
yeah, yeah. I think it's what's more important is that we are taking time away from other people. We're taking time to ourselves
Right.
to kind of escape into ourselves instead
Okay.
of trying to escape the world. Right? It's like when we engage in like drinking, right? We're trying to escape the experiences that we're having inside. We're trying to like numb those feelings, right?
Sure.
Uh,
Sure.
With writing, it's the opposite. We are centering, we're going inward. We're not trying to numb anything. We're trying to identify like, what's going on in here, what's going on in my
Yeah,
brain. So I think it's about taking any time that you can. If it's 10 minutes, that's great. That's what research shows is most
sure.
helpful. But if you can't do 10 minutes, hey, 5 minutes is probably good too, right?
Yeah,
You shouldn't be don't condemn the practice just because you can't make 10 minutes work,
yeah.
I would argue that anyone can make 10 minutes work, but maybe you're getting home from a 24-hour shift and the only time that you have to yourself before you walk inside to the dogs, to the kids, to your spouse, right? The only time you have is when you're sitting in the garage and you're sitting in your car and you turned off the car and you're just like sitting there and it's quiet, right?
Right.
Use that time, pull out your phone, do a little just
Okay.
expressive writing, right? So it doesn't have to be handwritten to paper, it can be texted out. Use a voice note, use
So
text.
you can use your voice.
Yeah, so it's about engaging in that internal reflection, and
Gotcha.
getting that out, write it out and then read it back to yourself really quick. That will take maybe 5 minutes.
Okay.
So it's that reflective practice of engaging in writing out what you're thinking or typing it out or talking it out. It gives us a structure to our experiences, which helps us start that sense making process, and coping
Nice.
process.
So you touched on the idea that this might be avoided because it stirs up uncomfortable feelings and emotions and
Mm.
experiences that we've had. What would you say about the importance of, and maybe not the importance, but the concept of being okay and accepting that this might make you angry and not avoiding it because it makes you angry or because it will
Mhm.
invoke sadness? Like maybe be okay experiencing those. What do you have to say about that?
Yeah, yeah. I think for many people who have not necessarily what we call PTSD, which is like the diagnosis of a post-traumatic stress
Sure.
disorder, but first responders often have what's considered to be PTSS, which is post-traumatic stress symptoms. So we're experiencing
Okay.
symptoms of the disorder, but we don't actually have the disorder. It's what we call it's a subclinical level. Um,
Okay.
that's oftentimes showcased by like emotional withdrawal or emotional reactivity, right? Because of that, and we know that we kind of tend to be a little bit more emotionally reactive, we then want to avoid any situations where we're going to feel emotions, right?
Got
Because
it.
we are not really learning how to control them. The cool thing about expressive writing is that because you're getting your thoughts and ideas already out on paper, you're starting
Yeah.
to think about how do I feel about this? That leads us to be less emotionally reactive later on if we do have to talk about this with someone or we choose to talk about this with someone because we've
Sure.
already thought about how we feel. We've already thought about what this is doing to impact us, and then we are less emotionally reactive. Then we start seeing that, okay, you start building confidence and competency and like, okay, I can control my emotions when it comes to something that's difficult and hard and stressful to talk about. Because I think a lot of times for first responders, we know that that's like a 0 to 100 thing. Like I'm either not talking about it, I'm avoiding it, I'm withdrawing, or I'm talking about it and then I'm like losing control of my maybe anger about the
Sure.
situation or whatever. It's about tempering that. And we temper that through this individual writing with ourselves because we're now starting to identify the emotions that we're feeling. And then they're not
Hmm.
a surprise to us when we're talking about it later.
Yeah. Yeah. So you say identifying emotions. When you say that, do you mean like naming an emotion as we start to feel it?
I
Or
mean, it
what do
could
you mean?
be. Yeah, it could be. It could be that I'm writing today that, um, again, so we'll go back to Jim. I don't know who Jim is, but we'll go back to
Right.
Jim. And
Yeah.
Jim's doing some stupid stuff on shift. He's not doing his truck checks completely. I'm gonna have him to go back and redo the truck checks or recheck things, right?
Sure.
In that minute, when I'm writing out like, gosh, this is really like Jim's not doing this, blah, 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 you're also then encouraged to write your deepest thoughts and feelings about that. So like uh, Jim's not doing this and it's really frustrating me, right? And so you're identifying that frustration. Um, and then you kind of go deeper. It's really frustrating me. Not only do I have to go back and do the work that he was supposed to do, but now I'm having to spend time on it, when I could have been doing XYZ. I could have been doing something else. And so it makes me feel like I'm now falling behind, or I'm trying to catch up in my day, right?
Right.
Those are all emotions. Those are all emotion words. And through identifying that while we're writing,
Hmm.
we're now again not going to be surprised by like, oh, that's how I feel when we talk about it later.
Gotcha.
And we have a lot more control over our emotions and our what we call our affective states
Okay.
when it's just us and we're writing it out versus in conversation with someone else.
Hmm. So, mental health we know is a pretty significant challenge in the fire service. What would you
Hmm.
say are some of the common misconceptions or barriers that contribute to keeping the stigma alive, and what can we do to start chipping away at that?
Yeah, yeah. I think mental health stigma is one of those things that we it's impacted at every level. So
Hmm.
I like to think about it in terms of it's a culture. It's a culture of silence that is built on multiple layers. At the lowest layer, we have interpersonal interactions and our individual feelings about mental health that are probably because of our past experiences with maybe a mental health professional that didn't really work, or we have a family
Sure.
member who didn't really like going to therapy, right? Um, we have that like kind of what we call consider this meso level or this middle level, and that's like those organizational policies, the support resources, the 1-800 number lines that no one ever
Right.
calls, but there's always a poster hung up in in the kitchen area that
Yeah,
literally no one's
exactly.
called that number ever, right? Uh,
Right.
and so, or like the critical incident stress debriefings, right? Those resources that we maybe have used, maybe we haven't. If we have used
Hmm.
them, the research shows that we actually don't like get any benefit from them really. Actually can serve to increase our psychological distress after doing a CISD or CISM
Sure.
experience. And so, because of our negative experiences with those and those
Hmm.
policies that aren't very helpful, stigmas they're created even more and more, right? Like, okay, well, this is what they have to offer and it's not really helping. I guess I'll just keep it hidden inside, right? And
Right.
then we have what we call these like macro or these larger social forces that are creating this stigma, like shows like Chicago Fire and Station 19, right? And
Sure.
those are like modern time ones, but
Right.
think about shows in history and like TV series and movies
Yeah.
and all throughout time, it's creating this what we call this like hero myth or this hero idea that we think
Hmm.
we have to live up to. And
Right.
because of it's all these different layers, they're creating this stigma and this kind of culture of silence about our mental health because heroes don't talk about their feelings. Heroes are strong. They don't need
Right.
to break down ever. Crying is not what heroes do. We don't really see. We
Right.
never saw Superman crying, right?
Right.
And
There's no
we're
crying in baseball.
there's no crying in baseball, exactly, right? So it's this like very very what we call systematic process where like the stigmas being created and reinforced at almost every single level, which makes it incredibly difficult to chip away at, and is
Hmm.
also really really pervasive. Like we see it every single day in almost
Sure.
every element of our life.
So what would be a good alternative strategy to the CISM?
Yeah, yeah. So right now, so CISDs, the CISM model that was created in like the 1980s. It
Right.
really has not changed. It's like this 7-step model that oftentimes we don't actually do all 7 steps, and that we've used for the since 1980s to like early mid 2000s, right? Like that
Yeah.
was like the standard of like critical incident occurs, we just have a debriefing. It's not been working, right? We know that it's not been working. We have research that says it causes more distress. We have research that
Okay.
shows there's vulnerability concerns. In volunteer organizations, which I have a special place in my heart for those,
Sure.
scheduling is a nightmare to try to get volunteers who have day jobs
Right.
and then any like law enforcement, any like of the doctors or the nurses at the hospital, right? Like trying to get a time when everybody can get together is just a nightmare. And so it's
Right.
not a viable option.
Mm-hmm.
Instead, where we've moved in the industry is these peer support programs, which I think at their core have really
Mm-hmm.
good intentions. The problem with peer support programs is they don't address mental health stigma. So,
Okay.
I can have peer support officers assigned in my department, and there's like 5 to 6 people that like they are the mental health peer support officers. They're mid management. They're probably like captains. They're not, they're not high level management. Like they're not the battalion chiefs. They're not the chiefs. They're captains. Those are the people that I could go to potentially, right?
Mm-hmm.
If I've never worked with that person, if I do not know who they are, they're not on my shift, right? I don't feel that trust or that close relationship with them. I'm not going to call them. I'm not going to talk to
Sure.
them. It's no
Right.
different than me talking to anybody else on the street, They
Right.
may get it. They may also be a first responder, but they may not be someone that I feel comfortable disclosing to. So I think the direction and the things that we can do are these peer support models. But when we formalize it with like, these are the individuals you can go to, it starts to
Mm-hmm.
feel too formal. It starts to feel too mandated. And first responders are like, nope, I'm not going to do this anymore because this is now starting to feel a little bit too much like a critical incident stress debriefing.
Okay.
And those don't work, right? So
Right.
it's about how do we create those relationships in a crew where you're supporting one another, and that's it. It's an ongoing process. It's not like a policy. It's not a
Right.
program or a model. It's
Yep.
has to be this more informal, just relationship oriented culture that you're building.
Okay. So from that perspective, let's say you have a crew of 4 or 5. What and let's just say I want to get better at supporting that authentically and
Mhm.
making sure it is what it can be. What is a like a training or some skills that I can start to develop that will help me become a better listener, better at what we're discussing?
Yeah, yeah. One thing that, again, I do stories and storytelling, right? One thing that
Yeah.
I found to be really helpful is we take a page out of the book of Columbia University's narrative medicine program.
Perfect.
So there's a doctor at Columbia University who's created this whole idea of narrative medicine, which is integrating, stories with being healthcare providers.
Okay.
And they have a practice that they call parallel charting, which I think could be really helpful for fire service, in which we have our patient care reports or the call report logs that there's a very specific structure and standard to what goes into, say, the narrative of a patient care report, right?
Hmm.
But the emotions, the feelings that you're experiencing, the frustrations that you have, that can't go in, that doesn't fit in a soap narrative, right?
Right. Right.
And so what you do instead is you create a parallel chart. So for a specifically difficult call, so like you have a critical incident, if a captain can say, "Hey, let's come back to the station, and after we like replenish, the medical supplies, we like finish like getting prepped for the next call. Let's go to
Sure.
the kitchen, and I want to just everyone sit down for like 5 minutes, 5-10 minutes, and you're going to write a parallel chart essentially.
Okay.
So we just did this charting, and while we are still in the mindset of the call and the information, we're going to now
Hmm.
write about like how that made us feel, or what was frustrating to us, or what do we want to do differently next time that will cause us less stress, right? Or what did
Yeah.
cause us stress. So it's essentially just like it's a place to write about that specific call in the moment. That information can't go in the PCR, the log report or the call report, right? Like it
Hmm.
has to go somewhere though, because we need to write it out. That can be really helpful. And then especially what I would recommend is that then as a crew, as a group, you're then reading what your parallel chart said. It's it's about taking that step to be vulnerable, to disclosing like, this is how it made me feel. It can be a
Hmm.
lot more effective when it's just you and your crew that just experienced that call, because there's this
Okay.
understanding that like we just all experienced this. Like no one's going to be really like worried about what other people are thinking because everyone just experienced it. We were just
Right.
doing this together. And it's not like a whole, like there's doctors there, there's the law enforcement there, there's also the chief there, there's the
Hmm.
mental health officer, the organization there,
Right.
it's
Right.
just you and your crew. And you're being asked to do it by, typically, if it's like your captain, right? You're
Hmm.
being asked to do that from someone that you trust and that you work with every single day, not someone who you see as a little bit more far removed, like a chief or a battalion chief, right? That you don't necessarily
Right.
see every day. That process can be really, really helpful to start breaking down these barriers of stigma, at least stigma within your crew. It may
Sure.
not be stigma across the whole department or across the
Hmm.
industry, but within your crew, it can start to break down those barriers of, okay, like I can be vulnerable. I can talk about this kind of stuff,
Sure.
and when you talk about it, I always say to my people that I work with is that I want you to not editorialize what you wrote. So you don't start off by
Okay.
saying, I don't know, I didn't really know what to write, or this is kind of dumb, or I don't know if this is correct, or I
Right.
don't know if I
Right.
did this right. Like you skip all of that stuff and you just look at your piece of paper and you write or you read exactly what you wrote down. So you don't
Okay.
editorialize yourself. And then we then respond to each other with like, yeah, I'm feeling the exact same way, right? Like
Okay.
that how you said that is really aligning with like what I had wrote over here too, right? Or when you said that, it made me think of this moment on the call, right? So
Hmm.
it's about responding to each other in ways that are very active, that ties what they said to what you're also feeling, right?
Yeah.
That shows us that we're listening to someone. So when we can kind of what we call communicate our perspective to someone, or that communicate that we're taking their perspective, it makes us feel heard and seen and witnessed. And that's how we start breaking down that stigma and that experience of, oh, I don't know if I should talk about this right now because they may not really want to hear it. And it's like, no, like we actually do want to hear it. First responders are a
Hmm.
very storytelling culture. We
Okay.
love to tell war
Yeah.
stories, right? We love to talk about it. But unfortunately, when we tell war stories, it's again the like, oh, this is so cool, right? Versus
Yeah.
like, yeah, this is so cool, and it made me feel like this, right? Or
Sure.
like, this is so cool, and I realized like I really need to have more and more training on this because I was feeling pretty incompetent at this skill on that call, and
Yeah.
and that's that level of vulnerability that can come with the war stories, with the telling of a call to your buddy or to your peer.
Hmm.
It's like, here's what happened. That's why it was cool, but also this is how it made me feel. And it can also be positive things too, right? Like
Sure. Sure.
this happened and I did really well at this and I'm really proud of myself for doing it that way, right? And then we
Yeah.
witness somebody and be like, that's awesome. I'm really happy. But like it's a cool experience that you got to do that. And I can tell that you really enjoy doing it. Like something like that,
Yeah.
where we're giving personal responses instead of just like, oh yeah, cool, right? And they're just like very
Right.
impersonal. It's a lot. It's emotionally a lot to do, but it's
Sure.
really important to then start building those close, trusted relationships among a crew.
Yeah. And so it sounds like validation
Yeah.
from your crew is huge, and I think anybody in a relationship may be. I know I am personally finding out that being able to validate my wife and being validated by
Mhm.
my wife is really essential to the success of a relationship that you hope to maintain and keep for a long time.
Yeah. Well,
Y-
as much as it might be corny to say, like we are married to our coworkers.
Sure,
We
sure.
spend a lot of time. So a general population, 8 hour workday,
Yeah.
you're spending 8 hours at work with this individual, right? For first
Hmm.
responders, you are spending 24 hours a day with this person. Like you
Right.
are spending a lot of time with these people. So it has to be relationship driven. Like the
Okay.
culture of first responders, I think this is where we need to be going in the future is we have to start being more relational driven. We have to start thinking about how am I creating a positive culture in my crew? And this isn't for the chiefs of the department. That is not going to be helpful for them to think
Sure.
about this, right? This is
Right.
for the captains. This is people who are in charge of the crew. How do I create this like very relational, focused, uh, safe, trusted space
Yeah.
within, my 5 to 6 people or however many it may be, right? Like
Hmm.
that's what's really important, I think. I think sometimes we rely and lean too much on the chief to
Hmm.
create policies that are going to fix mental health, and it's like that. The top down is not going to change the culture. It has to come from bottom up, or
Right.
what I truly believe, it's that middle. It's the captains. It's that middle level that you see these people in leadership roles, you trust
Hmm.
them, uh, and and those are the people that are going to be able to start making change on a daily basis.
Yeah. So everybody out there listening, we need you to step up and start being a leader when it comes to changing, how we handle these type of things. And I think that what it's parallel, um,
Parallel
re-
charting. Yep.
parallel charting. I was going to say reporting, but parallel charting. I think I'm going to try that with my crew. I'm not the boss, but I'll bring it to my boss, and we'll
Yeah.
we'll see if we can experiment with that, and you know see what happens. So I know we started talking about your research and we kind of got off, but we maintain a pretty good trail there.
Yeah.
Um, can you tell me about your research and then point to me the highlights or the results that you think are like kind of interesting or inspiring?
Yeah. So recent research that I've been doing is I just tested the expressive writing
Right.
in a fire department, and so like that's the
Okay.
one that's the most recent that I've got data
Hmm.
on. I asked members of this fire department to write about their untellable tales for 3 days for 10 minutes a day, and
Okay.
those that completed the 3 days found that they had significantly less depression on the second and the third day, significantly less negative mood on the second and the third day. So, those long-term benefits.
Hmm.
But, you know, just like I talked about before, that short-term distress, they also had decreased positive mood. So they didn't feel as positive or happy, but only on the first day. And then that went away by the second and third day. So it's this idea of like it's this short-term kind of like, oh, I feel a little crappy about this, but if I keep doing it, I start to realize that like, oh, I'm feeling less depressed. I actually have
Right.
less negative mood about this. So that's like one of the most recent research projects that I've completed, and that study is in the process of being published right now.
Oh,
That was
cool.
the dissertation. What was really cool about that project is it was culturally grounded in that fire department. So
Gotcha.
this is a department that I had not worked for or worked with. I went to one of the battalion chiefs who I had a connection with, and I said, "Hey, I'd like to do this study. I'd like to spend a lot of time with your guys first,
Hmm.
then design some kind of intervention." So I went into, the meeting with the fire department leadership saying, I don't know what I'm going to do. I don't know what we're going to do, but
Hmm.
what I want to do first is just learn about how your department works. So, for a year, I did ride alongs. I attended shift meetings. I did a lot of research about that organization, looked at their annual reports, looked at who worked there, and I really got to know that organization and like its core energy. That's kind of how I talk about it.
Nice.
And
Yeah.
then I talked to the individuals and I said, what would work? What do you need? Right. And then they talked to me about things like it can't be formal. If it's formal, like a critical incident stress debriefing, it's not gonna, like, we're not gonna want to do it. It can't be mandated by the chief. It's not something that that you say, like, you have to do this. And it's like, we are already mandated on too many things. It can't add to our daily stress. So through this process, then I identified, hey, we have this thing called expressive writing where you
Hmm.
write for at least 3 days for 10 minutes a day. This should be helpful. It's been shown to be beneficial for mental health in a lot of other populations. So men with testicular cancer, and young girls who are dealing with bullying in middle school. Um,
Sure.
it's
Right.
really helpful for a lot of other groups. We've not tested it in first responders though. So that's what was really cool about
Cool.
this study, is that this is the first time we've tested this kind of therapeutic technique of expressive writing for three
Hmm.
days for 10 minutes a day in this population. And
Nice.
it fit what the organization needed, and So we say in that way it's culturally grounded. It's grounded in the culture of that organization. So it's going to be more
Gotcha.
successful, more likely to be successful. And yeah, and then found some really great results about it. What was awesome through that is that not only did we have like the statistical results that showed
Mm-hmm.
decreased depression and negative mood, but I have 60 untellable tales of the things that first responders don't like talking about with other
Okay.
people, right? And it's got 60 untellable tales that I can go through now and I can see like what are the things that people don't want to talk about.
Yeah.
And one of the projects that I'm working on this fall and into the spring is going to be looking at, is there a way that framing these stories, is that indicative or predictive of health? So if you wrote
Okay.
about the story in a more negative way, or what we say a contaminated way, so the story started out really good but then it ended badly, so it's like a contaminated storyline, uh, is that predictive of decreased mental health essentially? If you told the story and it kind of started crappy, but it got better by the end, is that
Mm-hmm.
indicative of better health? Which are theory and research and past research, all that kind of stuff, that would predict that, like, or that would, we would predict that if you are a more positive storyteller, you have a more positive frame to the stories that you're telling, even if they are untellable and traumatic and difficult, that if we can put a
Mm-hmm.
positive spin or a positive reframe on them, we're going to have better mental health. And then, so I'm currently working on that project right now with that data to see if that's the case. And if it is, then we can design other interventions and trainings about, okay, how do we help first responders not only do this expressive writing for 3 days
Mm-hmm.
for 10 minutes a day, but how do we help them do it in a positive framed way? Because that's where we see the mental health is really like benefits the most, is when it's a positively framed
Yeah.
story versus like just like a telling of all like the really negative things and you just kind of like wallow in like the negativity, versus if we can put a positive
Right.
spin, even if it's like one sentence at the end, like I end on a positive note type of a deal, right? I will
Sure.
see more positive benefits to my health. So that's something that I'm currently working on, in addition to the study that we talked about earlier, of
Yeah.
the first responders as family.
Yep.
And yeah, and so I'm really excited about those studies that are currently ongoing and recently published.
Wow. Those sound like they could really impact the long-term success of fire culture and individuals and and start improving mental health. Is
Yeah,
there a
yeah.
way that anybody that's interested, or like a department or anybody who's interested in helping your research or being a part of your research, can get in touch with you?
Yeah, so you can go to my website. So it's drtrevorkauer.com is my
Mm-hmm.
website. There's some information about me up there about past research that I've published, and there's links to those articles. There's a tab that says participate in research. So any current ongoing projects that I have are posted there, and there's kind of like a little
Sure.
contact form that will send me an email that says you're interested. I also have a newsletter that is not like really a newsletter, but it's just like a mailing list essentially, that
Mm-hmm.
if I have a new study opportunity coming up for first responders, jump on it so that you can get notified when a new study is being posted. And then I've got another tab in there that's just about just different press. So the different articles that I'm publishing, blog
Great.
posts that I've written, things that are going to be helpful for first responders or very other similar occupations that are what we consider to be high reliability. So other things like the military as well. So yeah, it's all up on
Perfect.
my website, drtrevorkauer.com.
drtrevorkauer.com. Dr.
Yeah, correct. Hmm.
Trevorkauer.com.
Yep, that's
Awesome.
it.
Well, Doctor, I really appreciate you making the time to come on and talk today. Before I let you go, I do have one thing that I like to surprise most of my guests with. It's a
Yeah.
question. If you had priority traffic for our audience, what would it be?
Ooh, let's see. It's fun. This is the question I also surprise my interview participants a lot with is at the very end I say, what's the moral of your story, or what's the
Yeah.
lesson that you've learned, right? I
Yep.
think if there's, one priority trafficker, this one takeaway message I want you to know is that, stigma it's alive and well, and we
Mhm.
recognize that. But there are things that we can do to attend to our mental health and start to chip away at that stigma right now. Culture changes very slowly, but that doesn't mean that we can't take control of our own mental health using things like expressive writing or parallel charting or creating close, personal, trusted relationships in an organization that is dealing with our mental health now and starts to contribute to that mental health stigma culture change that we need to happen.
Excellent. Well, doctor, again, I appreciate your time, and I hope we can get back together and talk about future results and future research. If
Yeah.
anybody's interested in getting in touch with Dr. Trevor, please reach out. His email. No, we don't have your email. We have your website.
Yep.
But we'll send people to the website. I'll make sure I link it up in all the show notes. And
Yep.
again, I appreciate your time so much. Thank you for all you're doing for the service, and keep up the good work. We need more people like you.
Yeah. Thank you so much.
All right, guys. This is Chris with Party Traffic Podcast signing off. Everybody have a great day, and we'll see you on the next one. As all great things do, this episode of Party Traffic Podcast has come to an end. And from the bottom of my heart, I'd like to express my gratitude for your time and attention. Your support and feedback help the show to continually improve our content and to bring you the best possible experience. If you found value in today's discussion and it has challenged your current practices, we encourage you to share this episode with your colleagues and friends. Don't forget to like, subscribe, and follow Party Traffic Podcast on our various channels to stay up to date with our latest of shows. At Party Traffic, we strongly believe that prioritizing wellness is the foundation of long-term high performance. By taking care of ourselves both physically and mentally, we can unlock our full potential and achieve greatness. We are honored to be a part of your journey towards self-mastery and grateful for you being here with us today. Remember, together we can prioritize wellness and realize the performance we deserve. Thank you for listening to Party Traffic Podcast, and until next time, stay safe and stay committed to your well-being.